the HemaClear can be used on most patients. However, there are several very important contraindications that everyone must observe. First of all, the HemaClear should not be used for more than 120 minutes, 2 hours. This is the upper limit. We do not allow putting the HemaClear directly on the ulnar nerve or the peroneal nerve to avoid direct pressure on the nerves. Patients with peripheral vascular disease, poor vascularization and blood flow, we do not recommend using the HemaClear. Those are patients with diabetes, smoking, Buerger disease, etc. Patients with suspected DVT, okay, deep vein thrombosis, should not be allowed to use the HemaClear, with the risk of releasing a thrombus, a large thrombus, and causing a massive pulmonary emboly. This is the same as with the HemaClear, and it should not be allowed. If the limb is unstable, namely fractured, the HemaClear should be used with caution and using axial traction to avoid buckling of the fracture. Patients with poor skin that is very thin, like you see in some patients with renal failure, or patients with burns, bulla, etc., HemaClear should not be used. Most people recommend not to use HemaClear or HemaClear bandage for that matter if a patient has cancer, has some infection in the distal limb, with the idea of not spreading cancerous cells or bacteria into the rest of the body. And finally, if the HemaClear for some reason is not occluding the blood flow into the limb, the HemaClear should be removed immediately to avoid pooling of blood in the vessels. These contraindications are listed in the insert that you will find in each box called the application manual, and you'll find it in many languages. Everyone should be familiar with those contraindications to avoid mishaps with using the HemaClears. Thank you.